Everybody.
Mel? Sophie.
Good evening, everybody. Before we start, a couple of quick announcements. 3 weeks from now, I believe it is, our next program will be on women's health, and I would suggest you come because things are changing in terms of concepts there significantly. Secondly, we will be entertaining Lenny Solomon and Schlock Rock here on Shabbos Hanukkah. I believe that is the 12th, Eric?
Yes.
Of December, the 12th of December. Right. Details are available. Details are available on the slips outside. Please take one before you leave and make your reservations because you will have a great night of entertainment with him. He's been here before and he's terrific. Okay, tonight's session, great title. It's not, some of you got a little bit of the wrong title. It's called Demystifying Mental Illness rather than mental health issues. But Dr. Robert Barris, as you can see in our program, is a practicing psychiatrist. He's a member of the shul. He is a terrific psychiatrist. And please be free to ask questions for him. Raise your hands, please, so he can call upon you when he's ready. And let's give him a little big welcome. Thank you.
Sophie.
Well, good evening, everyone. So nice to be here. Actually, I'm here every week over there. But I thought I'd say a few words, but I don't want to turn into too much of a lengthy lecture kind of thing. And your invitation, Mel, that people are welcome after I maybe offer a few thoughts to ask questions, have more of a conversation, to me would be more fun, more fruitful than some sort of lengthy lecture. I first did want to thank you, Dr. Mel, for this evening, but really the broader context of all that you've set up. The more and more I've practiced medicine, and that's been a while now, since 1980, the more I realize just how critical that kind of participatory model is. That is, that really equal partnership between patient and doctor, between healer, healthcare professional, and one's own self, because nobody will ever know your body better than you yourself. And I think all this that you've been setting up is about empowerment. And the more information that you have about whatever the theme, the more empowered you are to take care of your own medical challenges, issues, whatever, or a loved one. So this kind of venue is all about empowerment. And I think the key is to, in whatever situation, to be as educated as you can. Sometimes doctors could be a little bit of ego. Is that a generalization? Is that ever the case? Is that just my own perception? Well, maybe. Oh, I don't know. So whenever I've had to play patient, usually I found myself being a drop self-effacing. Could it be, doctor? I had heard something, or may I ask a question? So, I try not to be too brazen, and yet making sure that I know as much as I can to ask intelligent questions and really be heavily part of the process. And be it mental health issues, be it whatever issue, just this kind of venue is just so vital. It's probably the most apropos title, talking about demystifying this process, because even in this time and age, there's still a heavy stigma regarding, psychiatric, psychological, mental illness. And I think someone even said, there may be people who'd want it tape because they'd be awkward coming here because then we look at them and say, oh wow, what's his issue, what's her issue. So even now, there still is that kind of concern of stigma. But Baruch Hashem, I would have to say that by and large I do believe that rabbis, clergy, are becoming more and more sensitive to these issues. Baruch Hashem, here we are at Eitz Chaim, so it goes without saying that our own Rav is always so much having that on his radar screen in terms of psychological issues, be it a shaila or coming to the Rav for a conversation, when it's something that might need referral for psychotherapy, couples therapy, or psychiatric. And I'm happy to say that even in circles that I never thought I'd get referrals, was pleasantly surprised. From rabbis in Borough Park, calling me saying a patient would come 10 times with the same kashrus related or taras hamishpacha related shaila, and I've given the same psak 10, 20 times, and they're still asking. I think they'll call me and say, I think this, to me, it seems like it might be OCD. Can you kindly assess? So there is becoming more of an awareness, a sensitivity to that, which is wonderful. Because why suffer in any ailment, medical, psychiatric, psychological? Why suffer when there's available options and treatments to alleviate suffering? Oh, in fact, I would have to say that often the earlier the recognition and treatment, often that argues best in terms of prognostically. So that sometimes I'll have situations where people will be in denial for sometimes decades, and by the time they finally reach the system, it's so much more difficult than had something been nipped in the bud early on. And I do believe that self-esteem is a theme that is so vital in my own thinking. And an example of demystification and the stigma. I remember one woman whose child, it was very obvious, had very difficult ADD issues, attention deficit hyperactivity issues. And my recommendation was, I think, a psychostimulant, something like a Ritalin would be quite helpful. But the mother was very indignant and almost like a certain self-righteousness to say, oh, I would never put my child on Ritalin. I would never do that to my child. But that was probably the greatest disservice, frankly, this mother could do for the child. Because with the ADD and the hyperactivity and distractibility and the acting out at school and at play dates, the child became more and more isolated because other kids, would not want to play with him or tell their mother, he's, God forbid, bad at school. He's always hitting and he's always whatevering. And though the mother felt, I would never do that to my child, giving my child Ritalin, but the consequences of being estranged from your chevra, not having play dates, being labeled as, like, God forbid, a behavioral issue, or he's just a bad boy, God forbid. The consequences of that, and then the self-esteem um, challenges that would ensue are a billion times worse than being on a pill that might help them enormously and turn their lives around. So I think we have to kind of also get over our egos when it comes to that, and simply embrace what's going on and seek the appropriate treatment. Again, why we're here tonight, after all. Again, I don't want to cover the entire gamut of things, and hopefully just offer a few thoughts. And what I think I'd enjoy most is just eventually just opening this up for a conversation. I just thought I'd share just a couple caveats of certain things I'll see, and where other psychiatrists have gotten into a lot of problems, and share that kind of thing. So just a couple of such examples. One thing I'll see frequent enough are children with behavioral issues, ADD, but have been treated by sometimes several psychiatrists and been put on Concerta and Ritalin and Adderall and every single psychostimulant, but that the psychostimulants only seem to make things even worse. So I get kind of a lot of referrals for that when people, could you please, please, please. And I think the awareness of bipolar disorder, even in children, is something I'm seeing more and more of, and would alert people to, especially when you hear of the child on Concerta is even more hyperactive, even more out of control. I would caution people to maybe think outside the box. Too often it's my experience that the psychiatrist will try this and then that and half a dozen different psychostimulants without ever stopping and thinking, well, let me think outside the box. Maybe something else is going on here. Especially I've found with childhood bipolar disorder. It's very different than how people think of typical adult bipolar disorder. In that with kids, if there's more like irritability and anger issues and just always being like in a nasty mood, just being moody all the time, that's sometimes, that's often how it does present.
Perhaps you should ask everybody to turn their phones on vibrate now.
That's true. And maybe before done, as much as I have, so much of my career has been in pharmacotherapy, the medication diagnosis, I guess my other big interest has been, beyond medication, has been meditation. And I'll get into that maybe in a few minutes, but the cell phone ringing and all that felt relevant because ultimately we can learn how to, in ourselves, cultivate a sense of equanimity. So, rather than my being here and all of a sudden cell phones are ringing and I'm getting thrown off and then getting, I can't believe it, I wasn't going to say, how can we learn in life to maintain that sense of balance, of equanimity in life? I just kind of went on a tangent with that, so forgive me. But I love this one quote of one of my teachers who would say, we can't stop the waves, but in life. We can't stop the waves, but we can learn how to surf. So in our own lives, with all our waves, if we could learn how to surf rather than be dashed against the rocks in our lives, that would be a wonderful thing to cultivate. And much of my own interests are in that realm besides the pharmacotherapy, the medication, the diagnosis, and that kind of thing. So one thing I do see in terms of my referrals, when they've seen other psychiatrists and things are just getting from bad to worse, has been that theme of childhood bipolar disorder. Just a couple other such examples. I would also add that in adult depression, a lot of times bipolar is terribly missed as well. And so often I'll have patients who've been on 12.5 different antidepressants, and it always seems to make things worse. Patients will come to you and say, well, I've been on Prozac, Paxil, Luvox, I've been on Celexa, Lexapro, and so often my feeling is, rather than just do the same thing over and over and over, can we as psychiatrists ever stop, put on the brakes, and simply rethink, well, what do I really think's going on here? Because a lot of times when I see these kind of difficult and refractory depressions, often there's those things that are suggestive of it being either a bipolar disorder with the ups and the downs mixed with both facets, or things that would suggest it is a bipolar depressed phase. And if that's indeed the case, the treatment could be so radically different. And the research is that the average length of time from manifestation of symptoms until bipolar is actually made is about 10 to 15 years, incredibly. And the number of psychiatrists, on average, that one has to go through until someone finally gets the diagnosis is about a dozen. So it's kind of staggering. So I don't want to be a broken record. Wow, Mel, so good you twisted my arm to get me up here tonight. But, the more information we have, the better. I remember in, I think it was grade 5, I guess it was good advice my teacher gave me, if I still remember it, which was kabdehu v'chashtehu, in anyone in life, to respect and to suspect, and as a patient to never just, whatever you say, doctor, I'm in your hands. That model rarely works, as opposed to that participatory kind of model. Another thing I do see a fair bit in terms of these kind of caveats vis-a-vis things are not working out. Sometimes in the realm of schizophrenia, that's often missed for likewise many years, where there'll be sometimes a protracted prodrome, where the individual will be more withdrawn, a bit more isolated. They had lots of friends, full and rich life, and now they're just kind of in the room a lot, more apathetic. And I've seen a lot of that where they've been treated with antidepressants and more antidepressants, sometimes for years, until sometimes quite a stretch of time later, some of those what are called positive symptoms will emerge, such as hallucinations, usually hearing things, or delusions, or disorganization and confused thinking. But as I mentioned right from the get-go, so often prognosis is affected by early diagnosis, early just jumping all over things and treating it. And it can be difficult when there's that kind of prodrome that's left unrecognized, sometimes for a long period of time, or the treatment being for depression, when indeed it's less depressed and more withdrawn, apathetic, isolated, what are called negative symptoms. in terms of demystification and stigma and all that. The same, I think, goes vis-a-vis psychotherapy. I remember when I was a trainee, one of my colleagues, trained to be a psychiatrist, herself said, I'm not going to go into therapy. That just messes you up more. I said, so here, I think my wife would often say that the healthiest people are those that are in therapy. At least they are taking charge of their issues in their life. And rather than the stigma of, they're seeing someone in psychotherapy, what problems do they have? Often she feels the exact opposite. I think that's true. That those are individuals who are maybe higher functioning and wanting to work on themselves, work on a relationship they might be in, and just have a deeper understanding into what makes them tick. So I'm glad as well that rabbis are also getting much more open vis-a-vis referral for psychotherapy. I know in this shul I'm obviously preaching to heavily the already choir, but it's just so important. I remember my very closest friend many years ago was engaged, and then just horrible issues were emerging, and it was just getting uglier by the minute, as it was just days before the wedding. And the rabbi's advice was, you get married and things just work out, that's just how marriage is, but don't worry. And that was such damaging advice that things got from horrible in those days leading to the marriage to just devastatingly horrific afterwards. And this friend took a long time to just recover from that entire situation. So, again, that stigma, we have to get past that. So a rabbi saying, just go through it, and these things just work themselves out. It's just such a wrong way to approach this. And the nature of the psychotherapies have really changed radically, as much as our pharmacotherapies, our medications, have gotten more and more sophisticated, more and more refined. So have our psychotherapies. That the same way in practicing and utilizing pharmacotherapy with the medication, the key word these days in our field, and maybe other fields as well, is evidence-based. So we can't say, well, I just kind of know from my heart of hearts that this kind of thing works, and trust me on this. That these days, that's just not good enough in terms of the medication. That's for sure true. And are these medications evidence-based for whichever condition? But in the last decade or so, ditto for the psychotherapies. That the age of the therapist being in the room, and and they're saying, I just do my thing, and I just know that it works. Trust me. Is also something that's on the passé, or should be passé. And happily, given whatever the condition or situation might be, would pull for different evidence-based psychotherapies. When I trained, everything was so very heavily psychoanalytic. In the late 70s, early 80s, it was very analytic. And I still do feel that an understanding of psychodynamic processes is just as invaluable in my thinking today as it was back then. And yet, the psychotherapies have evolved, heavily. Cognitive behavioral therapy has become just so huge. Maybe much more tachlis than years of analysis. People don't have the time for that, the money for that, and don't want to necessarily wait 5-10 years to see if indeed there'll be any results. And what's astounding to me is with certain psychotherapeutic tools, results can happen and pretty quick. So that was kind of quite a revolution when, especially in Philadelphia, and Aaron Beck started the whole field of CBT, cognitive behavioral therapy. And the same way that one might, when looking for a specialist, ask, do they specialize in such and such, in whichever medical condition, it's just as valid vis-a-vis psychotherapy to ask what's your orientation, or what kind of psychotherapy do you specialize in. It's also been kind of exciting to me because, again, in addition to medication, my interest has always been in meditation just as strongly. And what has excited me to no end, that in the last 10, 20 years, most of the cutting-edge psychotherapies in the cognitive behavioral realm are now heavily employing what they now call mindfulness practice. And, to me it was so cool to have something that I was forever interested in, and all of a sudden my field embraced it. Hook, line, and sinker, now it's like everywhere. To me, it has been enormously exciting. And I've found that it's broadened my vocabulary more than most of my colleagues, frankly. Just a few minutes ago, I used the word equanimity. Most of my colleagues talk about anger and depression and despair and hopelessness, all important things to understand and to address. But my own language also, my own languaging would also include concepts such as equanimity, compassion. So I'm sort of excited that the psychotherapeutic world has so heavily embraced this kind of stuff. Maybe especially putting it all on the map was Marsha Linehan from Seattle, and the dialectic behavioral therapy, the DBT, that she had started. What was most amazing about Marsha Linehan, who just revolutionized the field psychotherapeutically, especially with treating individuals with what's called borderline personality disorder. What was most amazing about Marsha Linehan is that she herself had been a cutter, and apparently I've never met her, but her arms are, all old, healed scars from having been a cutter, and she decided that she was going to heal herself, and came up with this incredible dialectic behavioral therapy approach, which is the most evidence-based psychotherapy now for many conditions. And I'm just kind of skimming the surface of some of those things that interest me, and then we'll open it up for conversation, because I don't want to turn into a whole lecture on one of those themes. Let me say one last thing, Dr. Mel, then I'm going to hear what you have to say. But I'm also very big on brain health. And most people don't think about that, really. We all think about cardiovascular health, especially if you're a cardiologist. But we're always worried about our arteries and the health of our heart and our circulatory system, as we should be, and how vital it is. But rarely do people actually think about brain health, and are there things that are actually capable of promoting brain wellness, or the contrary. I think the most revolutionary discovery in our field happened about 15 years ago. Because when I was in medical school, and for many, many years after that even, we were taught that you're born with a certain amount of neurons, brain cells, and they kind of mature, and there's that myelination that occurs until, like, your mid-20s. That's why people too young are not mature enough, because they still haven't had sufficient myelinization, especially in the prefrontal cortex that makes all those decisions. So if any of you have ever been young and done something really crazy, what was I thinking? Not that ever happened to me, of course. This is all in theory. That would be the reason that the frontal lobes hadn't matured enough. But then the thinking was that after around age 25, it was just downhill. And slowly, you lose brain cells every year until whenever. And the most exciting discovery ever to me was the discovery, again about 15 years ago, that it's just not so. That brain cells are regenerating all the time. And there's those things, though, that can promote that, or promote those stem cells progressing on and maturing into neurons, or the opposite. So that was just, for me, it just blew me away, that there's actually things that one could do to promote having more brain cells. That if you exercise, it makes you smarter. There's a book, Spark, by a Harvard professor of psychiatry, John Rady, that wrote that book, Spark, all about neurogenesis, promotion of more brain cells via exercise. So good for your heart, good for your brain too, which is amazing, especially in areas like the hippocampus, which are involved in memory. I had mentioned mindfulness practice before. The research is huge on that too, that it makes you have more brain cells there in the frontal cortices. They get thicker, and the cell thickness gets bigger and bigger. So our brains that were once thought to be static, until of course it just goes downhill, is totally not true. And our brains are forever being reshaped and being remodeled with new brain cells. So for that reason, exercise is fantastic. And I think the more you're able to get the heart rate up, the better. People talk about these days about high intensity interval training. And one of the best investments you could probably get is a heart rate monitor. They have those new Fitbits or the other ones that but exercising routinely and getting that heart rate way up there is good for your heart. I have two cardiologists. If that's incorrect, let me know. But it's equally good for your brain. And something else that's tremendously important for brain health happens to be what you feed it, nutrition. I heard one neurologist give a talk and said, I had to bring my dog to the vet recently, and the vet's first question is always, what do you feed your dog? It seems like a logical question. But do we ever ask ourselves that question? Or when we go to our doctors for whatever, does the doctor ever say, what do you feed yourself? Because there's those foods that are tremendously helpful in terms of promoting brain wellness and preventing against dementias and other conditions. And then there's other foods that are heavily toxic to the brain and do lead to eventually more and more apoptosis, losing your brain cells. So I just want to make a pitch before I turn it over to questions, to think about that concept of brain health, the same way you would about, cardiovascular. Baruch Hashem, you go for a jog and it makes you smarter. How cool is that? So,
So, I recall reading an article in the Wall Street Journal, as long as I can remember, it's getting harder to remember.
we're going for a jog later, you and I, Stuart.
Over 10 years ago,